Good afternoon, this is Dr. Do again. This video is on alphabetic list of problem. I still on the B list. Today I am going to talk about the a problem we have talked before, but I just like to extend it from what we talked. So the problem I'm going to talk today is basal cell carcinoma. Basal cell carcinoma. What is the is there any sign for this disease? Go to emergency? Pretty much no, you do not need to go to the emergency. Can you manage at home? No, you cannot. The only radical treatment, actually high rate of recurrence, but regardless, the radical treatment is go to the physician office to take it out. Okay. Before I talk about the basal cell carcinoma, I like just to briefly introduce the skin structure. So skin is basically it's a special lining up tissues called epithelial tissues. Okay. It's just because it's very strong. The cell shape is kind of flat. Not like a square, cubic, or the slender like a columnar, but this is a flat, multiple layer, stratified. The purpose for this arrangement of the cells is to increase the strength. Okay, between there's pretty much no distance. The interjunctions of connection between the cells are very tough. Multiple layers, multiple type of the connections in between the cells, and the 5 layers. The top layer usually probably about 1 month or so will fall off, undergoing the apoptosis or died and then fell off. And the bottom layer, which is basal cell layers, these layers serve as almost like stem cells because they can regenerate. So every 30 days also, these basal cells produce more cells, push up the other layers of the 5 layers of cells up to the top peak, undergoing the proliferation from the basic layer to the top layer. So that's why we have the skin fall off regularly. And this basal cell carcinoma, it's called carcinoma. It's malignant. However, like I talked before, does not have local or distance metastasis, which means it is not invasive. So talk about the malignancy of the cancer. Usually we talk about the very aggressive behavior of those cells, newly formed, lost the original morphology, either invasive locally or metastatic distantly. Through the blood, the cells falling off into the blood and then follow the blood flow, implanted somewhere. So this is called distance metastasis. For this basal cell carcinoma, it is a carcinoma, which means malignant because it lost the original morphology of the cells and the function of the cells. But it's not invasive either locally or distance, so it does not metastatic to other tissue, other area. Locally, it does not invasive. It's not invasive. So then, what is the purpose to get it treated? Usually, this basal cell carcinoma is on the face or neck. Is correlated with the sun exposure. So it's kind of shiny, pink. Shiny pimple like that, but it's non-painful, and sometimes there is a pit at the center. So of course a lot of case is just in case, or the cosmetic reason to take it out. And then usually if you have this kind of growth on the sun exposure area for a while, does not bother you basically. Sometimes it can, but occasionally can break the top of the skin, usually unless you really pick it with your finger and try to scratch it to break it. Otherwise, it's quite stable. So this is a malignancy, but it's probably one of the most relatively benign very well behaved cancer. Okay, so basically the treatment is very simple. Usually when we deal with the suspected malignancy, we do the biopsy, we send to the lab. For example, breast, you have tumor, take it out and send to the lab to do the pathology, see whether it's malignant or it's benign. If it's malignant, probably do either chemo or radical treatment and check the lymph node. For this basal cell carcinoma, just one time, take it out, leave a margin probably around the normal tissue, take it out, send to the pathology to diagnosis. Usually, no any further treatment. However, this basal cell carcinoma is tend to recur usually after a couple of years. The previous cell is removed at the same time, at the same site or different location. We'll have another episode or another growth of the basal cell carcinoma. In terms of mechanism, of course, sun exposure is the most common cause of this basal cell carcinoma, and preventive. I think is the key. How to prevent it, you know it. Wear the cap, shade the sun, and use the sun blocking strong. If you have family history, if you're light skinned, use sun blocking chemicals or cosmetic, whatever you prefer to get over counter. So this is really the purpose for this video is tell you about the skin regularly undergoing the regeneration of the basal cell and fall off the top cells, top layers, and just tell you about the metastasis in terms of local invasion or distance, and in terms of cancer behavior, either aggressive or not that aggressive. So this is and tell you how to prevent or how to recognize is a regular pimple or is a basal cell carcinoma. So if, like I said, usually it's non-painful, shiny, pink, irregular or regular shaped, and sometimes has a pit at the center. So if you have this growth for a while, go get it, check it out, so to take it out just in case. Okay, so this is the video for today, which is basal cell carcinoma of the skin. I hope it helps, and thank you for watching, and see you next time.